Let's start with the blood supply of head and neck. If you remember in the previous few lectures, we talked about the blood supply of the brain and the intracranial structures. So what we are left here is the other structures, including the blood supply to the face and neck. The arteries that supplies the head and neck are the branches from common carotid and subclavian arteries, as we know. And we previously talked about the common carotid, that at the level between C3 and C5, it bifurcates to form the internal and external carotid arteries. The internal carotid artery then ascends without any branching within the neck until it enters the cranium. After it enters the cranium through the carotid canal, it gives off several branches that supply the brain, the cerebellum, the brainstem, and the eye. This is to review what we have talked about previously. The main blood supply to the head and neck, starting from the aortic arch, which gives three branches. From left to right are the left subclavian, the left common carotid, and the brachiocephalic. Then the brachiocephalic bifurcates to form the right common carotid and the right subclavian. At the level between C3 and C5, then the common carotid bifurcates to form the left the internal carotid and the external carotid artery. The internal carotid continues up with no branching within the neck until it enters the cranial cavity, when it's then contributing to the formation of circumflex and giving the branches of the cerebellum to the cerebrum. The other blood supply system is the vertebro-basilar system. The vertebral arteries, as we mentioned previously, are originating from the subclavian arteries, ascending through the transverse foramen of the cervical spine, entering the cranium, then merging to form the basilar artery. Within this area, they supply the cerebellum. Then here they bifurcate to supply the posterior circulation of the brain. This is the image. This is left subclavian, left common carotid, brachiocephalic, right common carotid, right subclavian. Then these are the left and right vertebral arteries. Here we will focus on the external carotid artery, which gives the branches to supply the face and neck. So the mnemonics to remember the branches of external carotid artery is: some anatomists like freaking out poor medical students. Of course, not me, right? So S represents the superior thyroid, which is the first branch of external carotid artery, and the A for ascending pharyngeal, the L for lingual, the F for facial, the O for occipital, the P for posterior auricular, then the M for maxillary, and S for the superficial temporal. Let's have a look to these branches within the neck. This beautiful image is from Gray's Anatomy. This is the common carotid, and this is the carotid sinus. Here, the common carotid bifurcates to form the internal carotid artery and the external carotid artery. Immediately after bifurcation, the external carotid artery start to give its branches, starting with the superior thyroid artery, which descend to supply the thyroid gland, the thyroid muscles, and some other structures within the neck. Then the ascending pharyngeal artery, this small branch posteriorly. Upper, we have the lingual artery, the facial artery. Then on the posterior side is the occipital artery. More upper is the posterior auricular, and then finally it terminates into two branches, which are the superficial temporal artery and the maxillary artery. Let's talk about these branches individually. So the superior thyroid is the first branch of the external carotid. It passes downward and forward to reach the superior pole of the thyroid gland, as we saw in the previous illustration. Then the second branch is the ascending pharyngeal. This is the smallest of all external carotid artery branches, and it arises from the posterior aspect. It ascends between the internal carotid artery and the pharynx. The lingua arises from the anterior surface just above the superior thyroid. Then the facial is the third anterior after the superior thyroid and lingual. The occipital arises from the posterior. This is the second posterior after the ascending pharyngeal. Then the posterior auricula is a small branch arising from the posterior surface as well and passes upwards and posteriorly. The last two terminations are the maxillary and superficial temporal. The maxillary is the larger of the two. It arises posterior to the neck of mandible. And then finally the superficial temporal is appears as a continuation of the external carotid artery. So as we said, the last two terminations are the superficial temporal artery and the maxillary arteries. The external carotid artery then supply all of these areas, although it's not this much limited, but these are the main supply of these structures. So the scalp is supplied mainly by the superficial temporal artery. The face is supplied mainly by the facial artery. The maxilla by the maxillary artery. The tongue by lingual artery, and the thyroid glands by the superior thyroid artery. These are the main supply or suppliers, but there are some other anastomosis and other branches from other arteries. For example, here, if we talk about the superior thyroid, it's not just supplying the thyroid gland as the name may show, but it also supplies the thyroid muscle, the internal structures of the larynx, sternocleidomastoid and cricothyroid muscles, and so on. And same with the other branches of external carotid arteries. Here let's have an image. This is angiography without subtraction. So what we see here is the common carotid, right? This is the carotid bulb or sinus here. Then here, this is the internal carotid. It's larger than the external, and it ascends without branching. Immediately after the bifurcation, the external carotid starts to branch. The first branch is superior thyroid. Yeah, superior thyroid. Because there is another artery which is the inferior thyroid, but not from the external carotid. It's from the subclavian artery. Then the second is the ascending pharyngeal, but the ascending pharyngeal, as we mentioned previously, is the smallest. Yes, it's very small. I think that it is this one, but here there is a lot of overlapping. Then here it's this thin structure. Yeah, but it's very subtle on image. Yeah. Of course, on CT and MRI, even the large ones, sometimes they are subtle. I mean the larger ones, but not the largest. Yeah. Then after the ascending, we start to have the lingual artery, which is this one. Yeah, and then facial artery going to the face. The occipital artery supplying the posterior area of the scalp. The posterior auricula, this small branch. Then finally it terminates into these two branches, the maxillary artery and superficial temporal. This is the same image but with subtraction. So now the posterior structures are removed. What we are left with is the blood vessels. We move on to talk about the venous system of the head and neck. We already talked about the dural venous sinuses that drains the brain into the internal jugular vein, which is the main venous system that drains the head and neck. The veins usually accompany arteries and carry the same or similar names, but this is most of the time, but not all the time. The blood from brain empties into internal jugular vein, as we mentioned previously, which is formed by the confluence of various sinuses. Then the internal jugular vein exits the brain case through the jugular foramen, and then descends through the neck to the brachiocephalic vein. So the internal jugular vein is formed by the inferior petrosal sinus and the sigmoid dural sinus near or in the jugular foramen. then forming the jugular bulb. It then descends in the carotid sheath along with the internal carotid artery and the vagus nerve, which lies between the two. The tributaries to the internal jugular vein are these. This mnemonic may help to remember these tributaries. From inferior to superior, they are the middle thyroid vein, the superior thyroid vein, the lingual vein, the facial vein, the pharyngeal vein, and the inferior petrosal sinus. So here let's have a look to the venous system of the head and neck. As we mentioned previously, these are the dural venous sinuses within the cranium. Then they drain into the internal jugular vein, which descends through the neck to form along with the subclavian artery, the subclavian vein, to form the brachiocephalic vein. And this is the external jugular vein, which drains a part of the scalp and face. This is another image. So this is the internal jugular vein. As we see here, one of the main tributaries is the common facial vein here. Then we have the external jugular vein. Some of the tributaries to external jugular vein are shown here, like the superficial temporal vein, the posterior auricular vein, and the occipital vein. This is more down. Here we see the superficial thyroid and middle thyroid veins draining into the internal jugular vein. The internal jugular vein, after receiving tributaries from the face and neck, continue to descend, and then it unites with the subclavian vein to form the brachiocephalic vein. Then we talk about the external jugular vein. The external jugular vein is formed mainly by the posterior auricular vein and retromandibular vein. It passes across the sternocleidomastoid superficially, and then it passes deeper to enter the internal jugular vein lower in the neck before it then merge with the subclavian vein to form the brachiocephalic vein. The external jugular vein usually anastomoses with the common facial vein. So there is anastomosis between the internal jugular vein and the external jugular vein tributaries. This mnemonic helps to remember the tributaries of external jugular vein. Past, P for the posterior external jugular vein, A for anterior jugular vein, S for suprascapular, and T for transverse cervical vein. Let's have a look to the external jugular vein here. So we see some of the tributaries here, the posterior auricular and the retromandibular. And down here we see the transverse cervical vein. Here is more lower at the root of the neck. We see now what we are left with is the internal jugular vein. Then the internal jugular vein with the subclavian vein form the brachiocephalic vein. The two sides brachiocephalic vein then forms the superior vena cava and all the way down to the heart. We move on to talk about the lymph nodes of head and neck, and this is one of the important things to identify on images, because we know that lymph nodes usually drain the inflammation or metastasis or so. We need to know these lymph node groups so we stage the cancer or we differentiate the extent of the disease. This is the lymphatic drainage of the scalp. Posteriorly there is the occipital nodes group. Posterior to the ear is the mastoid nodes group. At the parotid gland area is the parotid nodes or preauricular nodes. Deep within the neck along the internal and external jugular veins and the internal carotid artery within the carotid sheath is the deep cervical nodes. And then under the mandible is the submandibular nodes. Under the chin is submental nodes. So these are the lymph nodes groups that mainly drain the scalp. These are the groups that drain the face, the parotid, submandibular, and submental. This illustration shows more groups, including the ones that we have talked about: the occipital, the mastoid, the submental, submandibular. But we have other groups like the facial group here, the sublingual group, the anterior cervical group, and then the jugular groups are divided into superior, mid-jugular, and inferior jugular groups. Here we have the transverse cervical group, and posteriorly here we have the posterior triangle group. There is also a retropharyngeal group here. There is a classification system called the classification system of lymph node levels. This classification system is used to stage the squamous cell carcinoma of the neck. But we need to know that this system is not inclusive of all lymph node groups. For example, so the supraclavicular, parotid, and retropharyngeal space nodes are not included in this classification system. So the classification system is like this. Level 1 is for the submental and submandibular lymph node groups, but then they are divided into 1A for submental and 1B for the submandibular. The 2 is for superior jugular lymph node groups, and then 3 for the mid-jugular lymph nodes group, the 4 for inferior jugular, the 5th is for transverse cervical and inferior spinal accessory lymph node group, and then 5 is divided into 5A and 5B by the cricoid cartilage. And then 6 is the central compartment, including the pretrachea and the paratracheal lymph nodes group. Then the 7, which is the last level, is the infraclavicular and anterior mediastinal, including the thymic lymph nodes. This is the lymph nodes levels illustration. This diagram here is better explain what lymph nodes group drain what kind of or which structure. So for the submental, it's rarely involved in the early disease unless there is a cancer of the lip. So the metastasis of cancer of the lip is usually to the submental, but the others does not drain in the early stages to the submental. So when we see submental lymph nodes, we have to consider something near there. Or we have to look for other groups which may be drained earlier and then it drains to the submental. Submandibular drains from the anterior 2/3 of the tongue, the floor of mouth, the gums, the mucosa of cheek. The posterior auricular lymph nodes has the metastasis from nasopharynx usually. And then here we have the mid-jugular chain, which drains from several structures, including the oral cavity, the pharynx, and larynx. The posterior triangular lymph nodes usually drain the metastasis from nasopharynx, posterior scalp, ear, temporal bone, or skull base. And then the supraclavicular nodes may have the metastasis from thyroid, piriform sinuses, upper esophagus, and rarely from primary tumors below the clavicle. We move on to talk about the tongue and oral cavity. The tongue is a complex structure, but it is made principally from muscular structure. It extends from the oral cavity to the oropharynx. We know that it has very important contribution to the speech, to the swallowing, and to the taste. So this is how our tongue is structured. This is the root of the tongue. This is the tip. The anterior 2/3 of the tongue is called the oral part, and the posterior 1/3 is called the pharyngeal part. Between the anterior 2/3 and the posterior 1/3 is the terminal sulcus. This is the inferior surface of the tongue. At the base of the tongue, there is the hyoid bone, which forms the base of the tongue, as we mentioned previously, and the mandible anteriorly. Here, this is the floor of the mouth. We will talk about it shortly. This is the arrangement of the muscles that make up the tongue. They are divided into intrinsic muscles. These are the muscles that form the tongue, and extrinsic muscles. These are the muscles that attach the tongue to the surrounding structures. So, the intrinsic muscles include the superficial longitudinal muscles. These are longitudinal muscles parallel to the long axis of the tongue. And then there is a network of vertical and transverse muscles. Inferiorly, there is the inferior longitudinal muscles between the genioglossus and hyoglossus muscles. At the center, there is lingual septum, which is a fibrous tissue dividing the tongue into two parts. This structure will be seen hypointense on MR images. And then the extrinsic muscles include the palatoglossus. This will attach the tongue to the palatine bone. The styloglossus. This is a muscle that's extending from the styloid process to the tongue. The hyoglossus, from the name we know that it's coming from the hyoid bone to the tongue, yes. Genioglossus, it attaches the tongue to the hyoid bone and to the mandible anteriorly. The blood supply to the tongue is mainly by the lingual artery, as we talked previously, but it also has some branches from the facial and ascending pharyngeal arteries. And the venous drainage is mainly by dorsal lingual and deep lingual veins. The nerves that innervate the tongue are several. We have the hypoglossal nerve, which is cranial nerve number 12, the lingual nerve, the chorda tympani, which is a branch of from the cervical nerve, which then joins the lingual nerve, and then the glossopharyngeal nerve. Let's have a look to this illustration, which illustrates the blood supply, the venous drainage, and the nerves that innervate the tongue. The blood supply is mainly by lingual artery. Lingual artery coming from which blood vessel?
External carotid.
Yes, external carotid, as we said today. And then the venous drainage is by dorsal and deep lingual veins, which then drain all the way to the internal jugular vein. The nerve innervation is by chorda tympani, this branch from facial nerve, yes. The lingual nerve, the glossopharyngeal, and the hypoglossal nerve. And each of them has its own function. Here we have a look to the roof of the oral cavity. What forms the roof of oral cavity mainly? Yes, the palate. The palate. The palate is then divided into hard and soft. The anterior part is the hard, right, which is formed by the palatine process of the maxilla, which joins at midline. Then the posterior part is by the horizontal plate of palatine bones. This is how the palatine looks like. The anterior part is the hard and the posterior part is the soft. Posteriorly here we have the uvula. The floor of the oral cavity is a U-shaped space extending from the oral cavity mucosa superiorly to the mylohyoid muscle sling. The boundaries of the floor of oral cavity include, at this superior area, the oral mucosa space, and inferiorly the mylohyoid muscle. We will see images shortly. Anteriorly the mandible and mandibular gingiva, and posteriorly the anterior tonsillar pillars. The contents of the floor of oral cavity include the sublingual space. This is considered by some as an independent space, and the deep portion of the submandibular gland. This is the muscles that form the oral floor. So, the main muscle that form the oral floor is the mylohyoid. The mylohyoid, which extends from the mylohyoid line on the inner side of mandible, to the hyoid bone. There are two mylohyoid muscles. They join at midline by this curve. Superiorly, there is the geniohyoid muscles, which are attached to the inferior mental spines. Here, if you notice in the previous image, we see these spines. These are the attachments of geniohyoid muscles. Then they transverse parallel to each other to the body of hyoid bone. This is the lateral view of the oral floor. So this is the hyoid bone. This is the lower jaw, the mandible. This is the mylohyoid line, and this is the mylohyoid muscles. Then this tubular-like muscle is the geniohyoid. Let's have a look to the images, so we see how these structures look on the image. Because these are soft tissue structures, so the best modality to see them is what? MRI, right? We can use CT, but CT does not have that much resolution between these structures. So here we can see the tongue, the highest level, which is the superior longitudinal muscles, right? And then lower down is the vertical and transverse here. And then more lower is the inferior longitudinal. Here we will have the palatine. This is the root of the tongue. This is the tip. And here is the mandible. Another image. The section of mandible here is more clear. The cortex is dark, hypointense, and the bone marrow is hyperintense. This is the tongue, the root, the tip. This is the oral cavity. This is the palate. The anterior part is the hard palate here, see. In the next lecture, we'll talk about the pharynx and larynx, and we'll be back to these images. This is an axial steer image to show the tongue. As you notice here, there is this hypotense linear structure at the midline. What is this? Yes, lingual septum. This is the fibrous septa that separates the two halves of the tongue. And here we see the tonsils and oropharynx. This is steer coronal. So this is the tongue. These are the submandibular glands. We will talk about them in the next lecture. Our last section is the muscles of scalp and face. And actually, this was not on the curriculum of RCR that we have seen. But when I reviewed some previous exams, I found that there are some images at which they point to some muscles of the face and the head. That's why I have added them to the lecture. So, as Gray's Anatomy divided the muscles of the face into groups: the oral group, the nasal group, the orbital group. So we move according to this division. The oral group include the orbicularis oris, which is this round muscle around the mouth opening. And then another big one is the vaccinator, which is this one on the lateral view. Extending from the trigomandibular raphe here, and then attached to the maxilla superiorly and mandible inferiorly, and then ends to build with the orbicularis oris. This is vasculature. This is one of the large muscles and important muscles. So it will be seen clearly in the images. Then we have the masseter here. We will have a look to a masseter isolated shortly. The other muscles are small ones. Sometimes they can be subtle, be seen on the images. It includes the zygomaticus muscles, the minor and major ones. The muscles that elevate the upper lip and depress the lower lip. These are levator labii superioris and depressor labii inferioris. So from the name we know that this is levator labii and this is depressor labii. And then the muscles that are at the angle of the mouth are the levator anguli oris and depressor anguli oris. So interesting names, right? Yeah, it's easy to be remembered. And then we have this small muscle, risorius, and the mentalis here at the chin. Then we see a small part of the platysma. Platysma is a thin, flat but long muscle that extends all the way to cover the neck. In the next lecture, we'll talk about the muscles of the neck. Then we'll see the platysma. Here we just see a small portion of it. This is the vaccinator muscle. And here we see the masseter. The masseter is originating from the zygomatic arch and then inserting into the mandibular angle. It has two parts, the superficial part and the deep part. And it's supplied by masseteric artery and masseteric nerve. We move on to talk about the orbital group of facial muscles. These are just the orbicularis oris, the largest one, and a very small one, which is corrugator supercilii. The orbicularis oris is this round muscle that surrounds the eye opening. It's divided into, or it's considered to be two parts, the orbital part and the palpebral part within the lid. Then the last group is the nasal group of facial muscles. We have the nasalis, the most important one, on the dorsum of the nose. It's divided into transverse part and this small part, the alar part, which attaches to the ala of the nose. Then we have this procerus that extends to the frontal bone. Sorry, we still have this group, which is the auricular muscles, but these are easy to remember. We have superior, anterior, and posterior auricular muscles. Then the scalp muscles are the occipitofrontalis. We have two occipitofrontalis on either side, like on each side one. Then it has anterior belly, which is the frontal belly, and posterior belly, which is the occipital belly. These two bellies are connected at the middle or at the top of the scalp by the epicranial aponeurosis. The temporalis muscle below the temporal fascia on the temporal area. And then it extends all the way here to the inner side of the mandible. So in the cross-section images at this area, we will see this muscle. Actually, the image I saw on FRCR in the exam, it was pointing to this muscle, the temporalis muscle. Here we review what we have learned about the muscles of scalp and face. Occipitofrontalis, occipital belly, frontal belly, epicranial aponeurosis. Then below the temporal fascia is the temporalis. The auricular group is superior, anterior, and posterior auricular muscles. The orbital group is orbicularis oris mainly, and the procerus. Sorry, the corrugator this one, corrugated supercilium, this small one, but it's not seen on the lateral image. Then the nasal group is the nasalis. The oral group, we have the orbicularis oris, the vaccinator, deep here, masseter. This is the platysma, this long, thin, flat bone, muscle. And then levator anguli oris and depressa anguli oris, levator labii superioris and levator labii inferioris. We have the mentalis on the chin, and we have the zygomaticus minor and major. There is also a small portion of the levator labii superioris which is called levator labii superioris aliquinazale at this area on the lateral area of the nose. It's another head of this muscle. Now we move on to see the images of what we have learned about the head and neck. So these areas are highlighted here in different colors. This is the vaccinator space, masticator space, the parotid space. This is the carotid space. This is parotid, and this is carotid. The carotid includes the internal carotid, internal jugular, and the vagus nerve. Yeah. Pharyngeal mucosal space, retropharyngeal space, perivertebral space anterior to the vertebra.
When describing images, you talk about these spaces, locations, and
yeah,
those particular locations.
Yes. Here we have a look to some structures. So here is the zygomaticus muscle. This is probably zygomaticus major. This could be the minor here. This is the masseter, which is extending from the zygomatic arch to the mandibular angle. On the inner surface of the mandible, we have the medial and lateral pterygoid muscle. Here we see the lateral. Then in the coming images, here we will see the medial one, medial pterygoid. Here we have longus capitis muscle. This muscle is originating from the transverse spine of cervical vertebrae 3 to 6, and then inserting on the inferior surface or basilar surface of the occipital bone, the longus capitis muscle. This is the internal carotid artery. This is the clivus. Here we start to see the tongue and the muscles of the tongue. This is the vaccinator here, and this is the masseter. This is the medial pterygoid. Here we can see the internal carotid and internal jugular. And in the coming lecture, we will talk about the other muscles, the muscles of the neck. These two muscles are the genioglossus, right, at the floor of the mouth. Here we can see this hyoglossus, which is the most lower part of the floor of mouth. This is the masseter. On the medial side of the mandible is the medial pterygoid. This is the base of the tongue and the uvula. This is the longus capitis muscle, internal carotid artery, internal jugular vein, and this is the vertebral artery within the spinous, the transverse foramen of the cervical spine. This is a coronal CT image. This is the tongue, the oral cavity, the palate. This is the hard palate, and here we have a section of mandible on either side. And this is the zygomatic arch and temporalis on the inner area and inner aspect here of the zygomatic core. This is another coronal CT image. Here we can see the masseter which is originating from the zygomatic arch and going down to the mandibular angle. Here we see the genioglossus muscles, mylohyoid muscle. This is the body of London. Another image, temporalis muscle. This is the pterygoid processes of sphenoid bone, medial and lateral pterygoid processes, if you remember. The soft palate. So in the previous image, we saw the hard palate, right? And then here we see the soft palate posteriorly. This is the tongue, the masseter, and then in the next lecture we'll talk about the muscles of the neck. So this is the end of this lecture. Thank you so much.